Sure. I'm Melissa Baker. I'm a behavioral health consultant at HealthPoint, which is a large FQHC in King County.
All right. So I guess my first question would be, what do you enjoy about your job?
I'd say the best part of my job is helping primary care providers do their job. I have the utmost respect for primary care providers. Not until I worked in a primary care clinic did I really understand what primary care providers are tasked to do every day. And so if I can help one primary care provider help one patient that day, then I feel like I've done a lot of work. If I can help them see 20 patients, I can give them a breather in their day. I think inevitably it's the job of making the primary care provider do the best work that they can, and I find a lot of fulfillment out of helping them do that.
Oh. There's a lot of different models out there for integration, and you operate out of the primary care behavioral health model. Why the primary care behavioral health model?
Working in a community health clinic, we have a large population of need, and I think the primary care behavioral health model really meets the need of a population. It allows you to fully integrate into the clinic. You're able to see more patients, help more providers, and I think inevitably it just fits the needs of primary care. I think other models have a lot to offer, but when you look in a community such as community health that has so much need, that being able to access the population and be able to help with a multitude of behavioral health needs is really important. I also feel that teachable moments, so being able to offer the warm handoff, see patients when they're in clinic, when they're in crisis, when the need is present versus having them come back or schedule follow-up visits. I think it works much better to meet the need when it's happening, so being available in clinic.
You've been doing this now for almost a decade. Is there anything that you would recommend to a new BHC that's just about to start in a kind of an integrated primary care behavioral health setting?
Yeah, observe, listen, be assertive, ask questions. I think you have to be where the chaos is, and so, for a lot of new students or professionals who come into a primary care clinic, being in your office with your door closed and, not really stepping into where the action happens, you're really not going to be invested in the work. You're not going to really be engaged in the team. And so you need to be out where all the action is happening in the pods, interacting with staff, whether you're having discussions with them or you're just sitting and you're listening and observing what's happening. And if there's an opportunity to engage the primary care provider or medical assistant and offer assistance, then being able to assert yourself and offer to help.
Okay.
But to really sit back and just kind of see, how the clinic flows and start to see where the need happens versus, kind of rushing in and just expecting that they're going to take you up on your offer to help or that they're going to ask you for help.
Okay. Yeah. HealthPoint obviously runs one of the few pre-doctoral internships for psychology interns in the country that focuses solely on the PCBH model. Why do you think, what about an internship do you find appealing, and why do you think it's a useful thing for particularly pre-doctoral interns, but anybody looking to be a behavioral health provider to get that kind of training?
Yeah. Before I came into integrative care, I had no idea really what it was about, and I think students, it's a wonderful opportunity. That's what I was told when this job came up, and it was an opportunity that was offered to me. My advisor said to me that this is the wave of the future. This is where psychologists are needed. This is where psychologist skills can really be put into effect. There are so many individuals who will never step foot into a traditional mental health clinic or office or meet a counselor or therapist. And this is really where the need is at. And when I came to HealthPoint, what really surprised me was that it really did put me to the test, that I could use a lot of skills that I had gotten in graduate school, and that often I underestimated my skill set, even though I was still an intern, that I could really impact the lives of the patients that were coming into the clinic. But the breadth of the experience also was amazing. Being able to walk in each day and know that I won't see the exact same patients for the exact same reason, it really pushed me to be innovative and really to think outside of the box. And really to, offer my services in a lot of unique situations. I mean, primary care providers see patients every day that they don't know a whole lot about the condition or the illness, but they're willing to see the person and figure out a way to help the person and be creative in their recommendations. It really pushed me as a psychologist as well. And I think as a student that's a wonderful opportunity to have so early on in your career.
Awesome. One last question.
Okay.